What's the consistency of the stool?
Well, it's just quite loose. It's not like water.
Mm-hmm. Is the frequency increasing over the last few weeks?
Maybe. I've started going in the night as well.
Right, okay. And have you noticed when you flush, does the stool float, or is it easy to flush away?
It's just normal like that, it flushes.
Right. Have you ever noticed any blood in your stool?
No.
No. Okay. And you said that the frequency is 5 to 6 times a day?
Yeah, and sometimes once in the night as well.
Mm-hmm. Any pain with diarrhea?
Not really, just a urge to go.
Right. And any other problem, like problem with your appetite?
Not really. I think I've probably been eating more recently actually. Although I've actually lost weight. So.
Right. Any particular food that you notice that makes the diarrhea worse?
No, normal diet. Seems to be bad, whatever I eat.
Right. Any vomiting
No.
or nausea?
No, not particularly.
Right. And you mentioned that you have lost weight.
Yeah.
And how much over what period of time?
I don't really tend to weigh myself, but I've just noticed my clothes are a bit baggy. I've probably changed from a 10 to a size 8
Right.
over the past 3 months, I'd say.
Mm-hmm. And within that time, have you ever noticed any temperature or fever?
I've just been feeling really hot all the time, which is quite unlike me. Like this summer, I couldn't deal with all the heat. Just a bit sweaty and hot. Yeah.
Mm-hmm. So is it only during the summer, or it started only a month ago? So
No, even now, I'd say.
Right, even now.
Yeah, I feel really hot.
Okay. Have you noticed any sweating in your palms?
Yeah, I have actually. Yeah, just a bit sort of clammy all the time, and yeah.
Right. And how is your diet?
Like I said, I think my appetite's increased a little bit.
Mm-hmm.
But I think I eat quite a healthy diet, fruit and veg.
Right. Do you mind while I'm talking to you if I document?
Yeah, of course.
Okay. Thank you. And in terms of your general health, other than these things, have you noticed any other problem or things that's not quite right?
Well, yeah, my periods, they used to be like clockwork, and now I'm rarely getting a period, maybe like the past half a year or so.
Mm-hmm.
Or when I have got a period, it's been really light.
Right.
And that's unusual for me.
Sure. Okay. And have you noticed any skin rash anywhere in your body?
No.
Or any lumps or bumps?
I did wonder whether my neck felt a little bit swollen. Sometimes it feels a bit bigger than it used to be,
Mm-hmm.
even though I've lost weight.
Right. And since when you have noticed that?
Actually, my mum mentioned it to me a couple of weeks ago.
Right. And in terms of your past medical history or background, is there anything significant medically or surgically?
No, not really. I'm usually pretty fit and well.
Mm-hmm. So you don't have any medical illness in the past?
No, I don't take any medication.
No surgery?
I think I might have broken my arm when I was little, but no, I don't think so.
Right. Okay. And you mentioned that you don't take any medications?
No.
No. Any over-the-counter?
Oh, sometimes when I get a headache, I take paracetamol.
Right. Hope you don't mind me asking, have you ever tried any medicine for recreational purpose or drugs?
No, that's not really my thing.
Okay. And are you allergic to any medications?
Not that I know of, no.
And is there anything in the family that is significant medically going on?
I think my dad has high blood pressure. Other than that, no.
No. Any problem of joint disease, bowel problem in the family?
No.
No. Okay. And how many brothers and sisters you are?
2 older brothers.
And are they quite healthy?
Yeah, they're well.
May I ask you, what do you do for a living?
I'm a student.
You're a student. Okay. And how these symptoms are affecting your student life?
It's just really distracting in lectures and things, and I feel sweaty and hot, can't concentrate.
Sure.
Yeah, so it just makes everything a bit more stressful, really.
Have you missed any days to school or any assignments that you couldn't
sometimes
complete?
Yeah, I've managed to get it all in on time, but it's been a push. Usually I'm quite conscientious.
Right. And do you work part-time as well?
No.
No. Do you smoke or drink?
No, I don't smoke and don't drink.
Right.
Very occasionally have a drink.
Right. I'm just going to ask you something else. So, just to concentrate, some of the things that you said to me, that you are having diarrhea, your appetite is fine, but you are still losing weight. So, along those lines, have you thought about what might be causing all this? Is there anything going on in your mind?
I don't know, at first I thought maybe I was a bit stressed, and that's why sometimes I eat more when I'm stressed, and I've been eating more recently. But I don't really know, I'm not sure. I forgot to mention also why I thought it might be stress is because I'm quite shaky now. Like sometimes I see my hands shaking a bit, feel a bit panicky.
Sure.
So I thought it might be that, but I don't know why I'm getting the diarrhea.
Right. Yeah, we'll come to that. Okay. And do you have any palpitation or any pain in your chest? Do you feel out of breath?
No, I don't think so. Just sometimes feeling a bit sort of shaky and unsure, but not really pain.
Right. Any cough or phlegm?
No.
No. Any problem with your vision or eyes?
No.
Any pains in the joints?
No.
And you said that you feel a bit hot recently. Okay. So obviously quite a few things going on based on the description that you gave me, and there might be a number of things possible. Okay, but the fact that your appetite is good, you are losing weight, and you feel shaky, you are a bit sweaty, there has been some irregularities of your menstrual period, so that makes me think that it might be your thyroid is over functioning or hyperfunctioning. Okay, so we'll need to think of that, and we'll need to send your stool for some microbiological analysis just to rule out that there is no infection going on. Okay, so we'll arrange this test, and once we get the results, then we will start you on treatment. Okay, I'm going to ask one of my nurse colleagues to come and have a chat with you. Okay, and she will give you some leaflets about how to manage this condition.
Okay.
Do you have any question, any concern, or any question that you would like to clarify?
Not at the moment. I'll ask the nurse if something crops up.
Right. So the plan, as I said, that I'm thinking that we need to look into your thyroid function. So I'll arrange some tests, We'll send you stool sample for microbiological analysis. We'll give you some leaflet which you can go back and read to find a bit of more information. And I'm also going to write to your GP so that he is aware that whatever plan we are going to put in place. Okay? And once all the results are back, then we can treat you specifically. But based on your symptoms that you are feeling a bit jittery, stressed, we can immediately give you something to help those symptoms. Okay? And then based on the other test, we can treat specifically whatever your problem is. Okay? Is there anything else you want to know?
I don't think so.
No. Okay. And I will also examine you just to make sure that I'm not missing anything. Okay.
Examine.
Examine your glands.
2 minutes remaining.
Okay.
Okay.
2 minutes more.